Hey, this is Doug Fields, CEO of Institute of HealthCare Consumerism, along with Brent Macy, Managing Director, and welcome back to this segment of HealthCare Consumerism Radio. Before I introduce our next guest, I do want to remind our listening audience that all the surveys and the research and data that we just discussed on the first segment, because I know we put a lot out there, is on our website, theihcc.com. So you can find all everything there. We have joined us today David Blanchard with BeneFinder. David, good morning.
Good morning. How are you?
We're great. Nice to have you with us. You coming to us from Richmond today?
That's right, Richmond, Virginia.
Okay. How is it up in Richmond? They got hit pretty hard up your way with some storms, I think, yesterday.
We were involved, I would say. It was fun. It was a fun time.
Yeah. Well, good to have you here, David. I think you're doing something very interesting with BeneFinder. And why don't you kind of give our audience an overview of BeneFinder's niche in this space?
Sure, yeah, thanks. I appreciate you having me. So BeneFinder, we founded late last year as the ACA was turning on towards the open enrollment period, and built it as a website, a call center, and actually a physical retail location for the state of Virginia currently to help people find the right individual and family health plan. It's based on a proprietary algorithm that we have developed in-house to help estimate a consumer's cost under Plan A versus Plan B versus Plan C, based on some very basic inputs that they could provide us at an optional level. We do a subsidy calculation for the individual plans that are sold on the marketplaces, and ultimately get the consumer enrolled in the plan after they've felt comfortable with the decision support guidance. So we are assisting with individuals that are currently uninsured or individually insured, but also working with a lot of employers now who are considering a defined contribution mentality for their population, be they under 50 employees or even over 50 if they're inclined to pay the penalty and move on with that different financial strategy. So
with employers, defined contribution, attached to maybe an individual product, is that what you're...
That's the mentality. Yeah. I think the discussion in the smaller side, probably under 30 life cases, are where the benefit manager is also the CFO, is also the CEO sometimes. Yeah. They're wearing too many hats, and their benefit program has just gotten outrageously complicated with the new individual rate bands in the group market. And they've decided in many cases to give the employees even just a taxable increase to their salary to go out and buy a policy on their own to reduce headache and to really improve choice that they give their employees.
David, can you serve a national audience? I mean, if I'm a consumer in Boise or consumer in Macon, Georgia, you can, if we come to your website, you can work for people across the country?
Yeah, we're doing that in a partnership model right now. Okay. But as of January 2015, we'll be working in all 50 states in a total in-house way. We founded in Virginia and wanted to essentially test the market in Virginia, and have found that to be very successful and are excited to be expanding right now. So we'll be illustrating national plans and rates in a more direct way on the BeneFinder.com website, probably starting in October as soon as we get the new rates released, which is a bit of a mystery still in the industry.
Correct. Now, David, this is free for consumers, and your business model comes from the health plans. Is that
exactly? Yeah, we are established as a web broker, okay. So we are an agent in that regard, and are simply getting the baked-in commissions from each individual policy that come from the health insurer. So there's no incremental cost to the end consumer nor to the employer who wishes to use us at a consultative level for that kind of defined contribution strategy. And I think that's a big misunderstanding possibly in the marketplace, is that just as you might hire a tax preparer to do your taxes, you would assume you'd be paying a broker an incremental cost to do your healthcare consulting, and that's different in our industry.
Yep. Now, David, this is Brent. When you, what's the difference between what you all are doing and the federal HealthCare.gov website?
Well, right now we're actually illustrating both on and off exchange products, so that's a big differentiator in that we're trying to illustrate the entire market rather than just a subset of availability. The other biggest element is decision support. HealthCare.gov and the call centers are typically not even legally allowed to give guidance on which plan might be better for somebody's situation. They can only help you with the mechanical questions of enrolling and getting your passwords and making sure you're clicking on the right buttons. So we really have found that people come to us oftentimes after trying a HealthCare.gov or even a major carrier's direct call center or website, and are really pleased with how we can point them in the right direction in an efficient way and a friendly and free environment.
Now, David, when it comes to matching people up with maybe high deductible plans and an HSA, does your decision support include, the recommendation and the advice on HSA providers to match up with high deductible plans?
Yeah, we do have a repertoire of HSA vendor providers, and that's something that we've been working on, and the new website iteration will be even more apparent of sort of, okay, you've now elected an HSA qualified plan. Would you like to go ahead and also enroll in an actual HSA bank account? Here's some options, and we can go from there. But the algorithm itself is interesting in that it does point to a high deductible plan in many cases because it's asking what are your typical use patterns or your estimated use patterns for your medical needs. And obviously, if you're not using health care very often, that lower cost HSA tax vehicle is a huge advantage and is illustrated in that way on in the calculations.
David, do you see yourself partnering with some of the emerging private exchanges in this market, particularly those that around the individual products?
Yeah, we've really begun conversations with a number of private exchange providers across the country and are excited with where some of those discussions are going. I think a lot of the private exchange models were certainly designed from the group standpoint, but having an individual module is really important, and we're excited to be sort of aiming in that direction now as a potential white label or direct partner with some of these groups.
How about the benefit broker that's in place working with the small employer? How do you fit with them, or how does that all work?
Yeah, that's actually been a really big pipeline for us. I came from a benefits broker world in the group model.
Yes, I saw that. Yeah,
7 or 10 years there, and my old firm and all of my old competing firms were actually sending us leads almost every day because they're either not set up for an individual counseling type of environment, or they're simply not able to do it financially in a business planning way. So we've worked out commission splits and referral agreements and things like that with referring agencies in order to serve their needs or serve the needs of their individual consumer clients without them having to invest in the infrastructure of the call center and the web support and things like that.
Excellent.
Yeah, to our audience out there, just so everybody knows, David was actually recognized as the most innovative broker partner in our annual Outlook issue. So, David, congratulations on that.
Thank you.
Going back to kind of your business model, once an individual has selected a plan, how do you help them enroll? You touched on it a little bit. Can you go a little further on how you help them enroll?
Yeah, we actually take a really active role in that process, which is different than a lot of places. The fact that we are a federal web broker allows us to have access to a direct enrollment feature, which allows us to enroll either with an individual or on an individual's behalf, sort of through a broker backdoor portal through HealthCare.gov. So if it's an on-exchange sale, especially with HealthCare.gov states, we're able to take some information from the client, essentially either over the phone or do a data collection in a web form. And they don't ever have to touch HealthCare.gov. They don't ever have to touch the carrier website. We can do that directly for them through our staff and our database model. So that's a unique element to our platform in that we don't have to worry about someone being redirected from our website to a different enrollment website and losing either their product or their sanity in the process.
Probably both, right?
Right, probably both.
So on the platforms, obviously you got to have the carriers on there, the health plans. Who do you represent, and what states do you represent?
Right. As I mentioned, we're just selling in Virginia online right now, but we're licensed in just about every state. And the only states that we're not licensed in are simply just little fun paperwork delays with their bureaus. Right. So we're almost done in all 50 states. And we're appointed with every carrier in the state of Virginia, and we'll be doing the same practice across the country in order to be able to appropriately illustrate all the insurance companies that are available, with the goal of providing essentially what we've been calling sort of a universal exchange, where it's a public exchange, but it's also all-encompassing, so that you're comparing every plan, and that unfortunately leads to complete client-overwhelmed results. So the number of plans that are illustrated are so great that we use that algorithm significantly to reduce the number of top-ranked plans for the consumer, so they're not just completely baffled.
And that really helps with the communication and not as much education having to go in, because you're narrowing down a lot of choices based on what you've already provided them, correct, or what they've already gone through on the platform?
Exactly. They provide us with enough background information without being intrusive as to what type of insurance they typically will need. And so we're able to rank the plans sort of in their best interest right off the bat. Mm-hmm. And they can always adjust that after the results come out and pick from a different slate of plans if they need to make some adjustments to that. So that's important.
David, we got about a minute left on the program, and want to let you leave the audience with one takeaway, and then let them know how they can find you if they're interested in inquiring about your services.
I appreciate that. It's been a pleasure being with you. The biggest takeaway I'd say is use a broker or an agent or consultant whenever possible. Basically, in this market size, we're free, and don't pay the carrier extra margin for baked-in comp when you can use a partner to direct you. And that BeneFinder is going to actually estimate your total cost, so you can help you can make the right decision based on a full picture, not just premiums, and then a gut call, if you will, on the plan design itself. So BeneFinder.com is the easiest way to find us. Our phone numbers, emails, and other contact information are there, so that's where we'd start with folks.
All right, David, thank you so much for joining us on the program today. Have a great weekend up there. And to the rest of our audience, stay tuned for the next segment of HealthCare Consumerism Radio.